Hi, this topic about nasopharyngeal carcinoma. You can see this pinkish mass in the nasopharynx in the area of fossa of Rosenbuller. And this tumor is common between age 50 to 60 year of age, and it's having bimodal presentation between 15 to 25 year of age and between 50 to 60 year of age. It's having three factor: genetic factor, most commonly related to HLA, chromosome 6p21. Environmental factor mainly related with salted fish, salted vegetable and smoking, and epstein virus leading to undifferentiated type of nasopharyngeal carcinoma. It's common in China, followed by Indonesia, followed by Vietnam, followed by India. Incidence in worldwide about 1 in per lakh population, but in China recently it's about 8 per lakh population, and India it's about 4 per lakh population. And most commonly involved group is about 40 to 70 year of age. And MRI is the investigation of choice in soft tissue tumor. You can see the nasopharynx is full of this nasopharyngeal mass, and endoscopic biopsy of this tumor is gold standard to rule out. For staging of disease, you should do PET-CT scan, and these are the risk factors associated with the development of the nasopharyngeal carcinoma, like male, smoker, high salted diet eater, and living in the area of endemic like Epstein Barr virus. And the most commonly gene associated with this is related to chromosome 6p21, and this chromosome lead to genetic predisposition in development of nasopharyngeal carcinoma. And genetic factor mainly salted fish eaters and smokers. The HLA A2, B14 and V46 are associated with increased risk of nasopharyngeal carcinoma, while HLA A11, B13 and B22 are associated with lower risk of nasopharyngeal carcinoma. The recent WHO classification of carcinoma of nasopharynx: type 1 is keratinizing squamous cell carcinoma, type 2 is non-keratinizing squamous cell carcinoma, and type 3 is basaloid squamous cell carcinoma. So most common type is keratinizing squamous cell carcinoma, which is mostly related to the smoking. Second common is non-keratinizing squamous cell carcinoma, which is related to Epstein Barr virus. And third is very aggressive, that is basaloid squamous cell carcinoma. In non-keratinizing, there is two types: differentiated and non-differentiated type of squamous cell carcinoma. So, factors like smoker, Epstein Barr virus, and genetic are related to development of this carcinoma, and this is mainly multifactorial disease. The DD may be like juvenile angiofibroma, soft tissue tumors like fibrosarcoma, rhabdomyosarcoma, lymphomas may be non-Hodgkin's, Hodgkin's lymphoma, other tumors like neuroma, hemangiopericytoma, neurolimoma, neurofibroma, and paraganglioma, and other skull-based tumors like craniopharyngioma, meningioma are common DD of this nasopharyngeal carcinoma. So, this tumor now recently is you can do endoscopic biopsy, and biopsy you can do different type of detection like circulating DNA, circulating tumor cells, exomes. These can be ruled out by different assays like plasma DNA assay of Epstein Barr virus, biopsy or immunohistochemistry of the tissue to rule out other malignancies. So this malignancy you can rule out. The clinical presentation of nasopharyngeal carcinoma, most common presentation is unilateral neck mass, followed by bilateral neck mass, and neck mass overall presentation is about 76%. Nasal blood stains discharge is about 73%. Oral symptom mainly tinnitus, hearing loss, or earfulness. If headache is present, it means this tumor is spread intracranially, leading to the headache. Other cranial nerve palsies may be because of surrounding infiltration of the tumor in the area of jugular foramen, in the area of middle ear, eustachian tube, and these are the pathway of spread. Like it can spread laterally, eustachian tube, anteriorly nose. It may extend distant metastasis, mainly lungs, liver, and bones. It may involve parapharyngeal space involving ninth, 10th, 11th cranial nerve. It may invade the pterygoid muscle, leading to spasm of pterygoid muscles. So this is the presentation which may lead to the different direction spread of this nasopharyngeal carcinoma with having different presentation according to the spread of the tumor. So mainly MRI, PET scan, endoscopic nasal biopsy is gold standard of this tumor. So these three investigations are required for staging as well as treatment of this disease. Treatment mainly focus on radiotherapy in which this tumor is localized in the area of nasopharynx. If this tumor is spread to the lymph node, then you have to give CT, chemotherapy as well as radiotherapy. Sometime tumor of recurrence and persistent tumor in the nasopharynx may require some sort of nasopharyngectomy with wide excision. So this is the treatment for nasopharyngeal carcinoma. Main treatment focus for radiotherapy, then advanced tumor radio with chemotherapy, and surgery is rarely required.